One key aspect of deep brain stimulation as a therapy, as a way to strategize how to implement it in our clinics, has been revolutionized by the ability to use image guidance. Surgeons like me have used image guidance to implant our electrodes for decades. And of course, that image guidance has improved over the past decades, even very recently. Now, neurologists that are programming the device can use image guidance as well. And I've always said that now, in some ways, thanks to this incredible technology from Boston Scientific, neurologists and neurosurgeons can sort of speak the same language about this therapy. With that in mind, Boston Scientific released the Vercise Cartesia X electrodes. These are electrodes that have become sort of standard in my practice. They have 16 contacts instead of 8. And what that means is there's lots more opportunity to deliver this therapy across a broader region and to deliver therapy in a more specific, controlled fashion. I can say that because of image guidance, which is a technology we've been using now for a while, that really allows us to adopt these new electrodes and more rapidly decide which of those contacts can be used to optimize the therapy. In addition to that, Boston Scientific has released Illumina 3D. This is an algorithm-based approach that uses the patient's imaging and leverages image-guided programming to more rapidly guide the programmer as to exactly where that sweet spot is. And between these two technologies itself, we can truly offer patients more personalized outcomes in a much more efficient way. Based off of our experience with image-guided programming, we've seen patients get better from a Parkinson's standpoint in terms of decreasing their UPDRS scores. We've seen how incorporating this type of technology can allow us to simplify and reduce the amount of time patients are spending in their clinic and kind of get to that sweet spot even faster. And these effects seem to be also quite durable. These electrodes are all the Cartesia X electrodes. On the left is a subthalamic nucleus implant, and you can see just a perfect example of why image-guided programming is helpful. We can use this image to sort of find the sweet spot much more quickly and save you and the patient hours of time. The bottom contact and maybe the bottom two contacts there are very close to that blue structure. That's the substantia nigra. I wouldn't even waste my time starting there because I know that those side effects can be delayed and I might not pick them up in real time. So I would start sort of in the middle range of that electrode, probably at levels 3 or 4, which gets me into the dorsolateral sort of upper zone of that subthalamic structure, which, we know to generally be the sort of sweet spot for people with Parkinson's. So just a nice depiction of why image guidance is so helpful. In the middle of the screen, you can see how the palatal target, the GPI, the globus palatus interna, or the internal segment of the GP, is a relatively larger structure than the subthalamic nucleus. And here you can see across the whole dorsal ventral axis of the GPI, you can actually see the Cartesia X overlays within it almost perfectly. It's almost designed for that structure. This can be really helpful for people with dyskinesia and Parkinson's dystonia and motor fluctuations, and you can see how there are multiple options that you can try. In my experience, I would probably start a little higher up there based off of the image guidance, which again in this case can be really helpful and really speed up your ability to find the sweet spot for that patient. On the far right, this is probably a patient with essential tremor, could be a patient with tremor predominant Parkinson's. And here you can see the electrode traverses the VIM, or the ventral intermediate nucleus of the thalamus, in pink. And you can see, again, the bottom contact is actually sitting below the thalamus there. That's probably, in my experience at least, the zone underneath the thalamus, called the zona incerta. And while that can be helpful for some patients, often when you stimulate that area, you can get cerebellar side effects, especially at a high milliamperage. So I would advise probably starting more dorsal along that array, kind of like I did earlier. And again, just a nice example of how you can use image guidance for all three of these structures, the STN, the GPI, and the VIM. Going one step further beyond just image guidance, this is Illumina 3D. So this is the algorithm-based technology released by Boston Scientific, now pretty common in my practice because it really speeds us up. And how does it do that? Well, you can see here the green structure of the subthalamic nucleus. And certainly I could use image guidance to try to optimize the field for that structure, but it turns out that there's actually a more sophisticated way to do that. And that really, in my mind, is Illumina 3D. So this is an algorithm-based approach, and you can see it's really easy to do. The software, you can visualize it here with the patient's MRI scan. To the right, obviously, you can titrate the milliamperage or the dose of the stimulator, and you can also inform with very simple sort of notes here, what structures to avoid and what not to avoid. And again, this is the patient's own MRI scan. So this is the best way to personalize the therapy, and this can be done in the matter of seconds. This is a really nice visualization of sort of the different experience between these programming strategies. Illumina 3D really allows us to get to the sweet spot faster. This allows us to really hone our stimulation field and really design something that is personalized to this patient and optimized by his or her MRI scan and these critical structures that we want to either treat or avoid treating. On the right side of the screen, you're seeing this sort of traditional monopolar review. There's still a place for this approach in taking care of people with Parkinson's, but I would say it's probably in the minority of cases. But with the traditional monopolar review, relatively speaking, you're sort of doing it in a bit of a blinded fashion. And that doesn't mean you can't come to the sweet spot. And in fact, in my experience, if I do a monopolar review, I sort of end up in the sweet spot in the same location as the Illumina 3D gets me to, but it takes me, instead of seconds, it takes me often many minutes and potentially hours of time